If you've missed a show, the full audio library is at radiomd.com. And now back to you, the Owner's Manual Radio Show.
Terrific conversation with Dr. Richard Besser, Chief Health and Medical Editor from ABC News. His book is called Tell Me the Truth, Doctor. Easy to understand answers to your most confusing and critical health questions. The publisher is Hyperion for Dr. Richard Besser's book. And here again, Dr. Mike Roizen.
And in fact, we should say this is a wonderful book. I'm just reading some of the questions out of it and went through and read some of them. Obviously, I actually disagree with a couple of the answers, but very few. So should I take aspirin to prevent a heart attack, stroke, or cancer? And Richard, you say the risk obviously is greater than the benefit for primary prevention. How about if you add all of those things together? You're not convinced on the cancer data, I take it.
Yeah, this is one where I think an individual approach is so important. When we're talking about the heart disease, clearly there are many people where taking an aspirin every day can be life-saving. If you don't have those risk factors for heart disease, though, then I start to worry about the risk from bleeding. The aspirin and cancer prevention, I'm not convinced yet. I want to see more data, more information. That being said, there may be people who have very high risks for certain types of cancer that run in their family, and in talking to their doctor, they're gonna look at that equation in a different way. One of the things that I hope people take away from the book is the importance of owning your own health and looking at information and using your doctor as your consultant, as your advisor, because so much of the decisions we make when it comes to our health are value judgments, and everyone needs to do that for themselves.
What you talk also about, and that I couldn't agree more with that than you obviously stated. I wanted to get to a couple more subjects since we've only got a few more minutes. The question on the freshman 15, when my mother-in-law moves back to us from Florida for about 6 months, a little short of 6 months every year, I gain about 5 pounds when she comes back. So there's a mother-in-law 5, even if not a freshman 15. Talk about the freshman 15.
Yeah, I had always thought that was fact, that the average student when they go off to college gains 15 pounds. But in looking into the data on that, it's not true. There is some slight weight gain. It's about 3 or 4 pounds on average. I mean, some people will gain more and some will gain less. But I hope the takeaway on that isn't that you don't need to worry about what you're eating and how you're using your body. Those years in college are the time when a lot of people start to develop their habits around food, develop their habits around their bodies and exercise. And that's really, really important. But it is a myth that the average freshman gains 15.
What about, we get asked, and I've gotten asked again by on an email question for you, what about diet soda and sugar substitutes and weight gain?
Well, I think this is a really interesting area because, I think, if you're drinking full-calorie soda and you switch to diet soda, that's a good thing. I think switching to water is even better. But there are some data, there are some studies that raise concerns about how sweet diet sodas are, and that it can do two things. One is it can raise kind of your set point for sweet. It's so sweet that you can develop that craving for things that are that sweet, and that's not good because most of them have calories. The other is that there's this forgiveness factor. So, you're being good. You're not having that full calorie soda. You're having a diet soda. For some people, that gives them the permission to have additional calories in the rest of their meal. And if you do that, then you can lose the value in switching away from those calories.
Yeah, in fact, one of the interesting things is when you lower the price of healthy foods, people tend to spend the same amount. And so there are some places, there are some of the studies where they're trying to incent eating healthy foods, and when they lower the price of the healthy food, they just buy more total calories of food. So it'll be very interesting to see how that shakes out. Joe and I were talking about the shame in McDonald's saying it's not promoting salaries because not many people are interested in them. And I was saying the shame is that they charge so much more for a salad than they do for a hamburger, that if they lowered the price on, for example, a veggie wrap, and make it a dollar menu item like they do some of their other things, they might be able to sell a ton more.
I think you're right on target. Price is a big motivator, and if you have a fixed number of dollars to buy the family a meal, and you're getting more calories from a fast food meal of burgers, then that's the way you're going to go. The more you can do to bring down the price of the healthy stuff, the more people are going to go that route.
Well, I want to thank you. First of all, let me just ask one more question: which is your favorite question in here?
Wow. I really like the "Does Doctor Know Best?" question, because so much of it comes down to that. Oh, and the other one I really like is, do you need 30 minutes of exercise to see any benefit? The government has been saying forever that 30 minutes 5 times a week is what you need for health. But that, I think, becomes a barrier to a lot of people even getting started. Anything you do is of value, and there's studies that even 15 minutes a day can prolong your life. So just get out there and use your body. I think that's so important to health.
I totally agree. Thank you very much. The book is a wonderful book, Tell Me the Truth, Doctor, by Richard Besser. Thanks, Rich, and it'll always be archived at radiomd.com.